The nurse knocks on the patient's room and identifies herself using her name and title and asks the patient to identify themselves using two forms of identifier. She preps all of her equipment and sanitizes her hand in front of the patient. As she's about to take the radial pulse, she asks the patient to rest their arm on a flat surface with their palm facing up and at heart level. She uses her index and middle fingers and place them on the inside of the wrist just below the thumb of the patient. She's going to press lightly until she feels the heartbeat, and once she feels it, you count the beats for 30 seconds and multiply the number by 2 to get the beats per minute. Without telling the patient what she's doing next, she starts taking the respiratory rate to measure how many times the patient breathes in 1 minute. She observes the rise and fall of the patient's chest for 30 seconds and multiplies that by 2. She's making sure to monitor the breath qualities and if they're regular, deep, or shallow. While giving directions to the patient, she made sure to maintain eye contact while also speaking clearly, slowly, and directly to the patient. She places the cuff snugly around the patient's upper arm, making sure the arrow is pointing towards her brachial artery and that it fits properly. Now she's trying to locate the patient's brachial pulse with her fingertips. After she finds the pulse, she places the diaphragm of the stethoscope over the brachial artery. Ensuring that the valve is closed, she begins to pump to 180 millimeters of mercury. She deflates the valve slightly with her index and thumb and watches the gauge and listens for when the heartbeat starts and stops. Once she hears the last beat, she opens the valve and deflates the cuff completely and takes off the cup from the patient.